discuss a lot of things because we'll keep most of them towards for this.
Questions. So I kept
Yeah.
like around 25 to 30 minutes for your presentation and another 20 minutes, 15, 20 minutes for Q&A. So should be okay. Okay, we are ready. This. Oh. I have sent the thing in your group. Don't share it at the moment now. Sujit? Sujit,
Yes,
can you
sir.
hear me?
Yeah.
Yeah, let me mute the YouTube because the YouTube is playing side by side. So I'll mute it. Okay, I've paused it. I think there you can see how many people are watching. There are 2 watching now, live streaming. So it can tell us how many people are watching as well. Because the YouTube is playing side by side, so I'll mute it. Hey, you don't share the link at the moment. There you can see how many people are watching. Vignesh, don't share the link at the moment till we see 90 here. Then we can share the link. Okay. I'm allowing them inside now. And exactly 7:02 we'll start off, I think. Hello, everybody. Hi. I would request everyone to, actually, I'll change the setting to mute everyone. And I'll make you the co-host, Dr. Prakash.
Thank you.
Dr. Prakash and Sujit should be able to communicate. Are you able to talk?
Yes.
Can you?
Yeah. Okay. Okay. Because to avoid disturbance, I put a mute for all so that there's no disturbance in between. Later Q&A time, I'll open it up for all. This one, I actually mentioned that this is primarily for the final years. But I've opened it to all the clinical years in case they want to know. But the focus is mainly for the final years so that they benefit the max. Since people are coming in, we'll give one more extra 2 minutes. I just got a message. I can only host 99 people. I mean, apart from me. So we have reached the maximum. We can't, I guess 1 or 2 might be allowed. Okay, I'm sharing for those who are attending here, I'm sharing the YouTube live stream in the chat box for the pathways. So please connect through there if you're not able to get in. All right, we'll start. Dr. Prakash.
Yep, I'm ready.
Okay. Good evening, everybody. And we are going to start our webinar on AMC exams, Pathway to Australia. In this, we will venture many aspects of the exam as well as life in Australia and how you can pursue your career after MBBS there. Before we start the webinar, I would like to just mention some ground rules for all of you. One is like you are muted. Later, I'll be giving you the controls back to unmute and ask questions. Till then, what I would expect you to please write your questions in the chat box, which our presenter will address at the end of the session of the presentation. And then we are keeping a lot of time for Q&A. The presentation time will be around 20 minutes, 20, 30 minutes. And then we will have a Q&A session. For that, we are keeping 20 minutes approximately. And we might extend by 5-10 minutes if the questions are not answered. So with that, we'll try to cover up everything within 8 o'clock Malaysian time. Without further ado, let me pass the control to Dr. Sujit from SV Care, who are collaborating with us to organize this webinar. He will be introducing the speaker, and then the speaker will straight away move on. Those who have not, like your friends might tell you that I'm not able to log in, please tell them that a pathway, that YouTube link has been given in the Pathways After MBBS group. They can see it live stream from the YouTube. Thank you. With that, over to you, Dr. Sujit. Take it over.
Thank you, Professor, and a very good evening to all the participants. My name is Dr. Sujit Kumar. I'm the COO of SV Care Group and also Director of the SV Care Medical Academy. And today I'm very delighted, to see all of you. Quite a lot of participants, which is itself is an indication that we need to. There are a lot of people wants to know how to go about this Australian Medical Council pathway. And we at SVK Medical Academy, in collaboration with Manipal University College of Malaysia, has been successfully conducting this college. And currently, we are having 2 batches, batch 1 and batch 2. And we are going to enroll batch 3 from this May onwards. And our lead tutor, Dr. Prakash Rajendran, as well as he's also academic director of SVK Medical Academics. So he is our lead tutor and who's conducting this particular Australian Medical Council program. So today we are here to know more about this program. And just to give you all a brief idea, we also will be having a physical session with Dr. Prakash, whereby he'll be flying over from Australia to Malaysia, which will be held in Manipal University College of Malaysia campus in Malacca on April 25th and 26th. So today's session going to be like a short, brief, but a detailed explanation about MSAP program. So without further ado, I would like to hand over this to Dr. Prakash. Dr. Prakash, the floor is yours.
Okay. Thank you, Professor, and thanks, Sujit, for the introduction. Good day, everybody. I'm thrilled to see that so many people are showing a massive amount of interest. It definitely provides some insight for what you guys are thinking. You guys are planning towards, what your future should be, and I think quite correctly. Australia, it is a wonderful destination for doctors, especially, and that's what we're going to go through this. So let me get started immediately. So we're not wasting any time here. Okay. The big question is why choose Australia? I've just divided this whole uh, presentation into about 3 to 4 parts. Why choose Australia? What your pathway is going to be, and a brief introduction about the exams in that pathway and how we can help you out. I'll probably get Sujit to come back and explain about how we can help you out. And for more detailed explanation or more detailed information, we are having uh, a face-to-face session at Manipal University towards the end of April. All of you guys can join for that as well. Okay, why choose Australia? Now, this is not a big $1 million question. Okay, simply Google it out and you'll get a lot of information out there itself. Probably there's plenty of websites, plenty of pages out there giving you so many things why a doctor should move to Australia. But let me just highlight probably the most important things for doctors who's currently practicing and thinking about moving to Australia, or as a medical student, why you should be embarking towards a career here and practicing medicine in Australia. We're just going to keep the most important 3 points, probably, or maybe 4 points. Number 1, job opportunities. At any given moment of time, Australia is always in need of doctors, and we have at least any given moment of time about 10,000 jobs being available. This is shared between hospitals and GP, but any given point of time, And this gap is the prediction goes as this gap is going to open up more and more, and then we are in need of doctors from overseas to come and fill this gap up. That's number one, job opportunities. Number two, it is a direct pathway for permanent residency. So, you being a doctor, you coming here to work as a doctor, getting registered as a doctor opens your pathway to becoming an Australian resident and eventually becoming an Australian citizen as well. Number three, Australia is definitely a multicultural country now. We have a lot of individuals coming from various parts of the world coming and living here. So this is something that where I tell all my students, look, you're not going to miss your country, you're not going to miss your culture, you're not going to miss your food, you're not going to miss your language. Everything is available here. It's going to be simply another part of your country, but outside your country. That's how it's going to be. And last not but least, guys, this is some of the most important thing is your pay. Okay. Now, Australia does boast about saying that it provides the second highest salary for doctors in the world. Now, these are some of the, through some websites, I've really found out that the salaries can be quite high, but there is no evidence saying that, okay, it is definitely the number two, but it is one of the countries I would definitely say at least the top five or the top 10 countries for doctors who, I mean, for in terms of payment. And I'll show you some of the slides here as well. And then if you want to add to that, it has a very high standard of living, excellent medical care, excellent education. One of the top, I mean, any given time when you do a survey, one of the top 10 living or top 15 or top 20 cities, livable cities in the world, probably will find at least about 4 to 5 Australian cities on there. Okay. The healthcare system. This is something that came up recently, about 3 years ago, where the entire world healthcare system has been assessed, ranked according to number of categories. And you can see overall Australia ranking number three. I'm probably sure it's going to be number one, if not for that second column, access of care. It's a big, vast, big country. And sometimes you might see accessing a doctor or a hospital maybe about 2 to 300 kilometers. That's why it's so difficult. It puts us way below. But apart from that, administrative efficiency, you can see equity, healthcare outcomes, all that are pretty much really, really good here. Okay, here is what came up about a couple of years ago in terms of salary. Now, these are basic salary for doctors who are starting their career. So it says Australian junior doctors salaries by state. And yes, so the state is the one that governs the healthcare system here. It's not the country, it's not the main government. So the state will decide what kind of salary. You can see the Australian Capital Territory being the highest there, and followed by Northern Territory. Northern Territory is there, Queensland there, all offering very high. And as a starting doctor itself, you're looking almost about 70 to $80,000 a year. PGY2 you can see there, almost from 80 to $90,000. PGY3 as it goes long, it goes on increasing. As a registrar, it's almost about 150,000, 120 to 150, $160,000. And as a consultant, it goes more than 300 to $400,000 a year, depending on the field of specialty. Again, top 10 livable cities. You can see there Melbourne, Sydney, definitely number three and number four. This quite changes from year to year. Sometimes you might find it um, Sydney going out and Canberra coming in. But always what I would say is you might find at least about 2 to 3 cities sitting in this first, the top 10 position there. That's a brief few points for you guys to take home on why you should be choosing Australia. Now, what is your pathway? That's something that must be running through everyone's mind now. Now, there are three different pathways. I would say at least the main pathways for doctors to enter here. Uh, for IMGs, the international medical graduates, these are the specialist pathway. You have the standard pathway, and you have the competent priority pathway. As an IMG from um, who is who is not from England, not from Canada, not from New Zealand, not from Ireland or USA, the pathway is going to be a standard pathway. That's the pathway that most of us, almost 95% of us, would be taking to coming into Australia. And this pathway usually involves getting your medical qualification verified, then sitting for two exams, the AMC 1, the Australian Medical Council exam 1 and 2, and we'll go through those exams, what those exams are. So the standard pathway, again, I'm just uh, uh, going through those again. IMG is seeking medical registration with the board, the Medical Board of Australia, and they need to complete the two exams, the AMC CAT MCQ exam and the AMC clinical exam. On completion of both the exam, the AMC will provide you a certificate saying that you have successfully completed. And then the next step is to find you a job and then go ahead with your registration. So again, that's pathway, standard pathway has 5 main stages. The first stage is where you need to establish two portfolios, one with the ECFMG, the second with the AMC. Get your qualification verified. Once your qualifications are verified, the AMC will say that you are now eligible to sit for your MCQ exam. That's when where you go prepare for your MCQ exam, sit for your MCQ exam, clear your MCQ exam, then go ahead with your clinical exam, uh, clear your clinical exam, and then start applying for job, secure a job, register with APRA, and then move to Australia. Now, that's pretty much uh, 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 the flow that or the pathway that you're looking into. But you can always try and apply for a job after your MCQ exam. Yes, that's correct. You're hearing me correctly there. So you don't have to finish both MCQ and clinical, start applying for a job and start working in Australia. You can start applying for a job after your MCQ exam. And then while you're working in Australia, you can complete your clinical exam and then proceed going ahead with your general registration as well afterwards. So if you're going to work with MCQ only, it's going to be a limited registration. And there is a component on the third row there where I put as workplace-based assessment. So that's something instead of while you're working, instead of doing the clinical exam, if the hospital that you're working provides this assessment, you can go through that assessment as well without doing a clinical exam. So those are the main stages of the standard pathway. So this basically shows the roadmap, what you need to do going through that phases. So it all starts with your verification with AMC and ECFMG, sitting for AMCQ exam, sitting for your clinical exam, clearing both those exams. Yes, as a foreign medical graduate or an international medical graduate, you will need some kind of English language proficiency assessment. This could be IELTS or anything equivalent to that. That's not required for you to sit for your MCQ or clinical exam, but it is a requirement to get your registration, your initial registration with the Medical Board of Australia. So now we'll go on to the next part of the webinar, which is going to be a very brief introduction to what are these two exams. So the MCQ exam is a computer administrated exam. These are administered through mainly through an organization called the Pearson's VUE centers that's located around the world. The closest center for Malaysia, there isn't a center in Malaysia. The closest center for Malaysia would be at Singapore. And these exams are held around the year. Usually in the month of December and January, you will not see any exams, but from Feb to November, you probably might see number of exams opening up. And this is a multiple choice exam. And these multiple choices questions are in total, they have about 150 questions. It's a type A questions, which means you have a question, a clinical scenario, or a simple question with five possible stems. There can be only one correct answer, and you need to find that correct answer. And once you mark that question, then the computer will take you to the next question, and that's how it is. So you need to completely answer the question, and that's when you can move on. You cannot just say, "Oh, I need to come back later onwards." While I did the exam quite a long time ago, I had that opportunity where I can flag it and I can review it towards the later part. But nowadays, how the system is, where you need to answer one, then it goes on to the next one, and that's how it is. Um, and it focuses mainly on uh, basic medical knowledge, where the current medical final year medical students are assessed here in Australia. So it's not something at a level of where for a registrar or a PGY2 or a PGY3, not at a high level. It's at a very basic level, the same similar kind of assessment where the medical students here, the final year medical students are being assessed. That's how the questions are. Um, there are no, as I said, there are no review questions. The total uh, time duration for this exam is about 3.5 hours. And the scoring system is quite a unique scoring system with AMC. Um, the understanding is that not every question is marked or given the same kind of weightage. Some questions are less weightage, some other questions are on a different scale. And overall, out of the 150 questions, the total weightage is calculated for about 500 points. And you need to just score 50% of that 500 points, which is about 250 points. So once you get 250, you pass your AMC MCQ. Having 249 is not a pass mark at all. And I have come across number of my students who had gone up to that 249, but the pass mark is, guys, it's going to be 250. So how are these questions distributed here? Bulk of it, about 30% of it from medicine, 20% from surgery, and equal weightage being given for gynecology, obstetrics, pediatrics, psychiatry, and public health with 12.5% respectively. So as I said, you need exactly that 250, 50% of that 500, which is about 250 points to pass this exam. Once you pass the MCQ exam, that's when you will be eligible going on to the next step of sitting for your clinical exam or applying for a job. Now, the clinical exam, uh, it was it was a face-to-face exam at the main AMC building in Melbourne. Then during COVID, it became completely online one. Then it became where you had the online version and you have the face-to-face version as well. Now it's again reversed back to the face-to-face version. So this exam has 20 stations. You got 16 OSCE questions with 4 recitations, about 10 minutes per each station. Out of the 10 minutes, you have about 2 minutes of reading and preparing yourself for the um, for the station itself, and then 8 minutes inside the station itself. And this uh, 16 stations will include medicine, surgery, pediatrics, gynecoms, physical examination, assessment, and psychiatry. It can be simply a predominantly history taking one, a predominantly a diagnostic formulation, a predominantly how you would manage a case. It could be a chronic management or an acute management, or predominantly talking to a patient and counseling the patient and providing advice, physical examination, things like that. That's where it would focus on. Now, introduction. Now introduction to AMSAP. This is the specialized program that was developed by SVCare in collaboration with the Manipal University to aid all these IMGs for their pathway from A to Z, from the start to the end itself. Now, while I was going through this pathway, there was few organization that provides bits and pieces of small things, coaching classes for AMC 1, coaching classes for AMC 2, maybe a bit of help in your registration process. But this is where we are providing a comprehensive services involving all those 5 steps that I mentioned before. Everything is involved here in this MSET program. Now, perhaps I can get Sujit to maybe explain to you what these steps are and what we are dealing with. Sujit, would you like to do it, or shall I go ahead? We explain this as well.
Hi. Yeah, I think I can explain about this. Okay. Probably I can share my slide. Oh, okay, Prakash, you have already having it, is it?
Yeah.
Okay, fine. Okay, with regarding this MSAT program, right? Like as Dr. Prakash mentioned earlier, we are doing this in a very comprehensive manner, whereby we are having few stages. There are few stages how this MSAT program is being conducted, whereby there will be like a verification documentation stage when the candidate comes in. So we are going to verify their universities, and also we are going to help them in terms of doing the initial verification, which like a EPIC portfolio, AMC portfolio. So all these things will be guided by our team, as well as in terms of processing the applications. So our candidate does not, I mean, don't have to worry about all this registration process. Apart from that, there will be while concurrently this registration going on, we'll be having this preparatory classes, whereby for AMC Part 1 and also AMC Part 2. For AMC Part 1, the course duration will be around 3 to 4 months, maximum about 16 weeks of classes. Usually, these classes are catered in convenience with the students' preference. Currently, in our batch 1 and batch 2, we have been doing these classes during our weekdays, Saturdays and Sundays. If let's say certain classes are not able to be conducted during that weekdays, so the tutors will be liaising with the students and arrange it accordingly. And within this 12 to 16 weeks, the AMC Part 1 classes will be over. Then after that, we'll be like expecting the students, whoever wants to sit for exams, though, so we will be assisting them in terms of registering them for the examination. All these classes are done in a very how to say, like very organized curriculum, whereby there'll be dedicated and experienced lectures. The syllabus will be very structured. 99% of the classes are online classes, and there will be like about like a 2 days or 3 days of classes will be conducted physically, whereby the tutor will be coming all the way from Australia, and the class will be conducted in our Manipal campus. I mean, in Malacca, in Manipal University, Malacca campus. And these particular classes will be having like will be conducted through our seamless student portal, whereby the studying material will be there uploaded, and the duration of access for the study material is very unlimited. One good thing about this program is, if you are registered, for example, let's say you're registering yourself in this MSAT batch 3. If you're unable, for various reasons, if you're unable to sit for the exams immediately, let's say you're planning to sit for next year, you're still having the access, and you still can join the classes which will be happening for MSAT batch 4 or subsequent batch 5 or batch 6 until you pass the examination. Whereby we are trying to say that our team, lecturers, and also tutors are there fully dedicated until you pass the examination. Not necessarily once you join this batch. If, for example, let's say you're unable to sit for the exam, that doesn't mean that you'll be like left alone. We will be there guiding you throughout until you pass your examination. So that's what we meant about unlimited study material and so studying time frame. Apart from that, in this curriculum also, there'll be like a term evaluation and mock examination, whereby our tutors will be training you with various past year question papers, as well as in terms of the real-time examination. As Dr. Prakash mentioned earlier, the part 1 examination is fully MCQ computer-based. So each question will have like a time duration and pace. So we have developed a system whereby you will be sitting for the exam like some kind of real-time exam. We call it like a mock examination, so that you will get hang of it, like you get used to it. And this mock examination will be conducted not only once, every time when you are preparing for the exams and when you are about to sit for the exam. So our tutor will be guiding you and training you with this mock examination. Okay. I think next slide, Dr. Prakash. Yeah. Apart from that, we also will be like, guiding you on the IELTS examination, whereby there's like a minimum requirement, minimum score, which you need to achieve in order for you to work in Australia. And the most important and like very crucial point of the point which we're offering is also job guidance. We are going to, once you are like past this AMC part 1, we will be like finding a suitable job for you. We are trying to get our contacts in Australia, try to match your what they call your expectation and also your in terms of getting a job for you. Just to give you a clarification, there is no like we are not like guaranteeing you the job, but we will bringing you the job opportunity, the job vacancies. You still have to sit for the interview and clear the job. And as you all know, currently the situation is getting tougher. Initially, yes, with AMC Part 1, you can still work in, you can just go and start your employment in Australia. However, due to the high competition, we recommend you to finish AMC Part 1 and AMC Part 2, whereby the chances of you getting employed in Australia are much more brighter. So in that sense, we will be also guiding you in terms of job search, administrative support which involve in that particular job search. Also, we will be discussing with you in terms of your preparing your CV, conducting a mock interview, and also if there is any skills needed in order to get the job, in order for you to pass the interview. So all that guidance, of course, we and our tutors will be guiding you. And once, with God's grace and everything, once you successfully obtained, successfully completed the interview and also obtained the job, we will be also assisting you in terms of visa process. And also, in case if you need any logistic supports, we will be there to assist you. Yeah, Dr. Prakash. So that's what we are going to do for all our MSET batch candidates.
Thanks, Sujit. So, in a nutshell, what we're going to do is we're going to help you out. We're going to grab your hand and walk through those all 5 stages at each step of the way, provide you with all the kind of guidance and all the kind of support that you would require throughout this phase. That's what we're trying to offer you there. Okay, and to learn more about it, to find more information about it, if you're really super interested, you want to get more knowledge about it, I'll be there towards the end of April for a 2-day workshop. That workshop involves, going through what the MCQ questions would be, looking at how the clinical exams would be, and going through with all those steps in detail, all those 5 steps. When you talk about verification, what those verification mean, what does AMC mean, what does APRA mean, what does those verification with ECFMG mean, and how would those MCQ questions would be there, how would the preparatory class would be held, how the AMC clinical exam would be held, and all that we're going to go through on a 2-day workshop on the 25th and the 26th of April 2026. You can reach out to Dr. Som for more information about it, and register yourself so that I can see you guys there. Okay. With that note, guys, let's open up. This was a brief webinar. I know I haven't addressed a lot of things on this, but I'm happy to answer to any questions if you guys have anything that's running through your mind at the moment.
All right. First, let me clear the thing like. Okay. So now the participants can unmute themselves, but let's address the questions. Quite a few questions. Let's start from, I'll help Dr. Prakash to answer this. So I'll just read out the questions for you and you can, if it's answered, it's fine. Otherwise, you can just, again, re-emphasize. Can I know the duration of the course and for how long we'll get the access for classes? I think this was kind of answered, and so we'll move on. What are the chances and opportunities available in Australia for Malaysians to pursue surgical specialties over there? That's one. And what may boost our CV to stand out in local Australian candidates in getting selected to pursue residency in surgical? So What are the chances of surgical, or is there anything that can boost the CV to get a surgical opportunity in Australia? Over to you.
Okay, so in Australia, there are, as an IMG, initially, I would ask you guys to mainly concentrate on the industries where it's most likely for you guys to get a job quicker. Surgical tends to be a bit more a difficult job initially, but for especially if you are looking into a surgical pathway, I mean, looking into studying further in surgery, it is definitely an opportunity there. Um, um, Around 60 to 70% of consultants here in Australia are IMGs. Simply like that. I can just simply put because most of the doctors, most of the, I would say the native doctors or uh, the doctors who are passing out here, they tend to prefer moving towards the GP pathway. Uh, the main reason is that a GP pathway is considered as a specialty as well, and the pay is pretty good in that as well. So for IMGs, definitely, if you can, I mean, it's going to be very similar to what the UK is. There will be an initial exam, pass that exam, go through the training period, and then you can become a consultant. But to start with, I would say take the opportunity that's available and then move on to a field which is of your choice. Number two, CV. Now that's where we are going to really come and help you guys. Now, how the CV should be, because for any given post, I've spoken to a number of directors, number of recruitment professionals here. They say that, oh, I'm getting about 200 CVs, and I don't have time to go through 200 CVs to find who would be matched. So there are AI programs that's been used quite for a long time. And what this AI program does, it really try to match us, try to look for keywords on your CV and sees, oh, do you really fit in to the role? And if you do fit into the role, it probably will have those kind of point system. And the topmost 20 CVs has the highest points will be picked up and handed over uh, to the main recruitment. They will go through the 20 CVs, maybe calling about 10 of them for an interview. That's how the usual system works. So that's where we come into play. We have the knowledge of what kind of keywords that should be there on your CV. So making sure that, at least giving, likelihood of you getting a shot at the interview is high.
Okay, I think thank you for answering that. Yes, the CV thing, I have heard that you told me before, but it's good to tell in this forum as well. The next question is about internship. So I'll just this thing as in Indian NMC's rule, IMG is allowed to do internship in Malaysia, which is not possible. So are they allowed to practice after clearing part 1 and part 2 without internship in the MBBS program? I mean, after MBBS
It,
program without the internship. Yep.
it's a very tricky one. I would recommend everyone to complete their internship from the country of origin or anywhere else, and to have at least about a minimum 1 to 2 years experience. Those are the candidates who is going to be highly likely to land a job quickly. Because if I'm not saying that you can't do internship, there are individuals who have done internship IMGs who have come in, but the possibilities of securing those kind of internships is going to be a bit difficult. It's going to be quite difficult because you would be, as for when you're trying to go in for internships like junior medical officers, you'll be competing with Australian local graduates, Australian citizens who had graduated from abroad as well. And most of the IMGs, we fall under the lowest category. And that's going to be a bit tricky situation. So although I wouldn't say definitely no, but it is very difficult. So my advice would be try to get your internship done at the country of your residency or country where you are educated, and then to try to move to Australia. That would be the best.
Okay. Dr. Prakash, in case they cannot, do they have a chance if they cannot do internship? That's the question.
Yes, they have a chance, but the chances are very, very small.
Okay. Okay. After AMC part 1, um, it's a statement actually. I think I'll just convert it into question. Is it very difficult to get a job after AMC Part 1?
Uh, Almost about a couple of years ago, when I had this kind of talk about 2 years ago with at Manipal, I was saying that it's pretty easy because all my students with AMC one within 3 months were able to secure a job without any issues. But it's changing now. It's slowly by slow changing because of what's happening in UK. There are a lot of doctors from UK now pouring into Australia, and
Yes.
that has made it bit more difficult for doctors, IMGs from the rest of the world to find jobs quicker. So I would advise having your AMC one and AMC two puts you at a very better position to getting your job secured much quicker.
Okay. Okay, I think this one, I guess I can answer this question. The shadow housemanship that we have in MUCM is not really considered an internship per se, because this internship is usually a rotatory internship of 1 year after MBBS. So that one, I don't think that counts. So this one, I think I can answer this since it's related to shadow housemanship. This one, I think, is already answered. To guided, will we be guided to build our CV and train? Are you going to train them for interviews as well?
Yes,
Okay.
definitely. So once you have done your aim, once you have successfully completed your MCQ exam, we'll have a short course. I mean, when I say short course, for probably about 1 or 2 weeks of what are those basic questions like, how you should be answering this question. You'll have a small booklet to go through as well. And once you're locked in, let's say that you've been applying for a job and then you interview been offered, you'll have one-on-one training directly with me itself.
Okay. I think this one participant has actually wrote 6 questions. I'll go one by one. Expected timeline to secure Australian license and the total cost. The cost, I think, is in the brochure. That is for the training, but would you want to take that? Timeline to secure Australian license and the total
Uh,
cost.
I think the shortest timeline, you're looking at about 9 months from start to end, hoping that you complete your AMC one in one go, AMC two in one go, and securing a job for about 3 months and within 3 months, the shortest one. But I would say averagely about a year to year and a half.
Okay, I think since you said yeah, this is success rate year to year also. That is the next question. What is the success rate year over year? This thing.
Securing a job
I
or
believe so,
passing the exam.
because that's like written after that. So this is a bit non-specific. Maybe
So
Aman,
I'll
are
I'll
you around? Mr. Aman, you can unmute and ask the questions directly. Okay, I mean, since never mind, I will try to answer the other questions. Will there be
Yes, sir. I'm very much around. Thank you so
okay?
much for taking up
Yes.
this question. So the question around success rate was one, clearing the exam and securing a job, which was because that is the end goal. So year on year, what is the trajectory looking out? Is it increasing? Is it decreasing? Because you mentioned that a lot of doctors from UK and other regions are also pouring into Australia. So what about students, aspirants from India and other countries, specifically from India, because I belong from India. So what is the year on year success rate that we are observing? If it
so
is
Aman,
declining, then sorry. So I'm just concluding. If it is declining, then what are the major reasons? And
okay.
if yeah, thank you.
So I'll give you the correct. I had a chat about 2 months ago with one of the directors in a hospital. There were 10 of my students who I managed to put through to the interview with them. And out of the 10, uh, I would say the success rate there was about 20%. Not most of them. They were a batch of students from India and from Sri Lanka. And what they were saying mainly was they're not exhibiting the skills of what a doctor who is working here are showing in terms of how confident they are, how confidently they're talking on the answering the question. It's not about the knowledge, but the soft skills. And that's something that really took me up. And part of your part two training will be involving this as well, Aman. So we have incorporated that into our part two training, not in the part one. Part one is going to be completely your knowledge to pass. There's nothing. But part two, our tutors are training. Okay, what, how to increase this confidence as well, and improving your vocabulary. All those are playing a part in that interview thing. So that's the main thing. What they told is it's not about the knowledge, it's about the soft skill. So that's where I think the IMGs from the Asian subcontinent uh, are falling back when you compare it to these graduates or these doctors who are pouring in from UK.
Sir, can I please add one more question to this? Just a
Yeah,
follow-up
sure.
one. Sir, since I understood that IELTS clearance is also required, so vocabulary is something which I would seriously doubt is the reason for this low success rate. And so soft skills are very, very generic. If someone needs to just spell out the reason for rejection. Sir, is it attributed to the hostilities from the locals and immigration related, issues been popping up in Australia, the reports that we are reading out? Because it
No,
is,
definitely not.
then, sir,
Definitely not.
then, sir, this reason of rejection citing soft skills is something which I don't comprehend, and it's very hard to digest. Because if someone is clearing IELTS and clearing your part one and part two examination, so the student is stopping on the skills. That's why the person has cleared it. And then you are saying that the soft skills are something which is creating a bottleneck is something, not able to digest, sir.
Completely understood, Aman. Now, how this Australia is a multinational country. Okay, I'll just give you a basic understanding. What really triggered that thing. Uh, we have to learn how the system works here. Uh, we guys, I mean, I come from Sri Lanka, and working back there is completely different. Working here is completely different. Here, the doctor probably you probably have to working in a clinic or anything. You probably have to walk out, get the patient, and walk in. The patient is not going to come, or there won't be a nursing officer who is going to bring you in. Those kind of skills where you have to be much humbler than what we would be doing there. That's one thing, and 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 showing those skills in terms of your how you answer things like that. That's very very important. And so a person who has a bit of experience on that background does have an advantage. And yes, as you say, oh, I cleared my IELTS, I got 8.5. Look, the IELTS is not a requirement for the job. It's a requirement for your registration. So it's a very tangled thing here. The IELTS doesn't say how good you are with your English for your AMC exam or one or two, but it's just a requirement for your registration, just to say, oh, yep, you are you can speak, you can speak the language, you can read the language, you can write the language. We accept you to practicing here in Australia. So it's just a tick box for the board. But in terms of securing the job, this is where I'm finding a bit difficult. I mean, where they are looking into different kind of skills that could be matched with the local graduates and with I would say these graduates coming in from Canada or UK. And these are skills which can be easily trained. Mike.
Okay, I think thank you very much, Dr. Prakash. We'll come back to Mr. Aman if there's any other further queries there. We'll move on to the next question. How many receipts are allowed for AMC Part 1?
Unlimited. Unlimited
Okay.
for part one, unlimited for part two.
But that's not
And
what we would want them to do, though.
you don't want to, it's quite an expensive exam. You want to finish this exam in one go. It's quite an expensive exam when you compare it to the other exams around the world. And the exam is uh, um, valid for lifelong as well. So you don't have to worry. You can do AMC one. I know a fellow friend of mine who did AMC one in 2007. He has not done his AMC two yet.
Hi, Doctor. Sorry to just interrupt. I just have, I'm the one who asked the question. I just have one follow-up. touch wood that you don't clear the AMC Part 1 the first try, is there a time period that that you have to wait before doing the resit, or can you try apply for the next available exam date?
You can apply once the results come in. You can apply for the next available exam date.
Okay. Thank you, Dharma, for that question. I think Hemanti has asked question, cost of choosing this pathway and what does it include? This one, I think even I could answer you, Hemanti. And state of IMGs in providing internship, we are not getting, okay, that one, I think what Dr. Prakash said is if someone has an internship, it's great. If someone does not have internship, then the chances for getting in becomes a bit tougher, but it's not zero kind of thing. So it's just tougher. And how difficult to secure a placement in hospital after only AMC Part 1? I think that was answered already. With the influx from UK students, it's a bit difficult. When can student appear in this exam post? When can they take the AMC Part 1 and Part 2, Dr. Prakash?
So AMC exams are not held in the month of December and Jan. Apart from those 2 months, all the other months, the exams are available throughout the year.
Okay, this one I'm not sure. Miss Sagarika, could you explain? MAI, I'm not aware of this short form. Okay, I think if she comes in later, fine. Otherwise, we'll move on to the next question. This one, batch 1, yes. Okay, this one, I think Sujit will be able to answer this. But at the moment, we are just started since last year. So our students are in the process of writing the AMC Part 1. We have not, the batch 1, we do a bi-annual intake. But I think I'll let Sujit, because he has the access to the dashboard. So I think I'll let him answer. Sujit, the question is from batch 1 now, how many students are able to secure a job by AMCEP?
Okay, to be very frank, currently from batch 1, we only had 2 students, and batch 2, currently we have about 9 students. So all the students, I mean, like from batch 1, I think both the students are planning to sit in coming this May, actually. So this May, there'll be like 4 students going to sit for AMC Part 1. So to be very precise, so far, no one secured any job because no one has attempted the Part 1 examination yet. Hopefully, this year after the May, hopefully, if let's say all of them are passing the exam, so we try to secure the job by end of this year.
Okay.
Hello, sir.
Then,
Hello.
yeah, yes, Ms.
Hello,
Sagarika, please go
sir.
ahead. Yeah.
Yeah. Sir, this question is for my daughter.
Mhm.
She is I live in Melbourne. Okay, and she is in India. She got, she finished her MBBS. The question is for Indian graduates, after they finish internship, do they consider the traineeship as a work experience?
The internship, is that what you're asking? Do they consider the internship?
Because
Yes.
in India it's include like 5.5 years, right? So she has finished her internship. So do they consider the internship as a work experience?
Yes.
That's the
So
question.
internship is considered as a work here in Australia. So internship
Okay.
everywhere else is recognized as a work. Yes.
Okay. And already she has cleared like first time AMC Part 1. Okay, within 3 months, and she is working with Delhi, in a super specialty hospital, but she didn't get a like seat for say a Part 2 exam. I don't know why she applied, but she didn't.
So has
That
she
one,
applied?
okay.
Sorry.
This one, I think, Dr. Prakash, I think, like, with regards to not getting the seat is like, is it like application thing or like, are
No,
you saying like not
application. Yeah,
cleared?
exam date. Exam, Part 2 exam. She,
Okay. Then I think Dr. Prakash can answer this.
So did she apply? I mean, what happens with Part 2 exam is they don't have visibility throughout the year. So AMC
Yeah.
every now and then will open up. Okay, we are opening up slots for the month of, let's say, July and August. So everyone who is interested,
Again. Yeah,
yeah,
she already she applied, but she didn't get. in I think January or February.
Yeah.
Okay, so again,
So
she is applying, I think
yes,
June or
should,
July. Yeah, something
so
she told me.
what's going to happen is, ma'am, is that when they open up now, I know, let's say that when they open up saying that, okay, we are opening the exams slots for the month of, let's say, I'm giving you an example, May, June. This might happen in Feb, and within few hours, all the slots will be taken, and then you're thinking, oh, I'm lost. So you need to be
Within
really
not
on.
few hours. I mean, within few minutes.
Yep, exactly. So
Uh,
it's
five
usually
minutes.
goes off. It
Yeah.
just goes off at. So you need to be very, very up to there in trying to, because it's a very high demand exam, and anyone who is applying should be really ready. They'll say, okay, we are opening on this hours. Please book in your exam. It'll just go very fast. But if you're interested, the second step is you can put to AMC saying that, look, I'm looking for any exams that held in the month of this or this, because all those people who had signed up, sometimes some of them might, not go ahead. They'll say like, I need to postpone the exam for this reason, and there are
But
some slots that will open up.
yeah,
So then,
unfortunately, she didn't. She was like, I mean, waiting, but she didn't. They send a
Okay.
mail.
Ms. Chatterjee, I think
Yeah.
we'll take this offline because it's going in circles now. So I think I'll
Okay.
if you
Okay.
can
Thank you, sir.
connect with Dr. Sujit, I think he can also help you out. And I
Okay.
think the number, Dr. Sujit, please put your number there so that Ms.
Please,
Chatterjee
sir.
can connect with you. And then we'll move on to the next
Can-
question.
Hi, I'm a parent. I have two questions, quick ones. One is, how many seats are available for the AMC Part 1 exam? Is it limited like the AMC Part 2 exam, or is it, can a
no,
lot of...
no. So it depends on where you're trying to, which center you're trying to do.
Mhm.
Especially in India, there are plenty. Even if you look into Chennai, you might probably find a lot of number of locations. Whereas when you look into Malaysia, there isn't a single center. But in India alone, every city probably will have at least 3 to 4 to 5. So plenty there. So Singapore, there is one in Philippines. So it depends on the availability of the centers, because each center will, let's say a center has about 20 computers. So if that 20 gets filled up, then that center gets filled up. But
Sure.
there are places where there are plenty of centers, especially in Australia, various, even the universities have these centers. So it'll be if you're looking into Australia, it'll be much easier. Or else the next place where you might get a lot of centers opportunities would be India.
And sure, second very quick question. Once you've cleared Part 1, is there a time limit within which you must clear Part 2?
No, there is no time limit, ma'am. It's valid for indefinitely. So there is no time limit there.
Thank you. Thank you very much.
Thank you. We'll move
You're
on to the other questions. I think what specialties are most sought after in Australia? That is one question. Dr. Prakash, is there any
I would say,
particular for IMGs, I believe, this question?
so in terms of specialties, everything is available, but the high demand ones would be anesthesia, emergency medicine, psychiatry. These would be the high demand ones, and even geriatrics is coming up a lot now.
Okay. Right. Thank you. Which roles can I apply for if I have MRCS Part 1? MRCS Part A, sorry. Is that recognized? MRCS, that's a UK thing.
Now, that's something I think that person, I would ask them to maybe contact Sujit, because
Yeah.
that's going to be like a specialty pathway. It's a completely different pathway to this. So maybe we'll discuss it separately. Maybe
Thank you.
contact Sujit and we can talk later.
So I think I'm not sure, name is Jan. So maybe you can connect with Dr. Sujit. So he's giving his number here. This is a question from Tijan. There are some changes done in 2026 regarding AMC Part 1. Could you expand on that?
The kind of questions have been changed a lot. How the questions that we've been seeing that a lot of the way the questions are being created, or the questions, how the questions are has been changed. That's the main changes that we are coming across, and which simply means that we need to move towards this newer kind of question style to pass these exams.
Yeah, for Tejan, I think I just want to tell you, Dr. Prakash, Tejan is also our alumni from Sri Lanka. So, and Tejan, we have this course on 25th, 26th. Do join, do drop in to Malaysia for a couple of days if you can. I think next question, I think that was answered already. This one is from another student of ours. Various sources that AMC need doctors, especially rural areas. So what are the chances of landing a job for IMGs with no internship? Are there better chances to go to rural areas if we don't have internship?
It's the chances are going to be in the rural areas if you're trying to do internship here. It's going to be in the rural areas. That's where it's going to be. Definitely not the big cities.
Okay. Are you eligible to clear the AMC with only a transcript of MBBS course after passing year 5 exams? Year 5 means, I believe, after MBBS. So eligible to
As
clear,
far
to write the exam, I believe.
Yes, you don't need an internship to clear your AMC1 exam. So all what you require is a degree saying that, yes, you have completed this qualification and the university is ready to verify that you have completed. That's what's required.
Great. I think this question from our student Rakshita, around which SEM should we start preparing? Well, we usually try to enroll from the 9th semester, so that the last 1 year you have prepared for most of the things and you can take your time to read also. It will help you for your MBBS per se as well, because after all, medical knowledge is not very different, only the protocols might change from country to country. So I would say 9th semester would be a nice time to start. But we had one student who wanted to start from 8th sem. I think that one we made an exception for that. Okay, hi, already I'm in Malaysia for past 4 years as medical officer. This question from Ms. Dr. Felix. Currently in private GP clinic, if I were to pass AMC Part 1, what job maybe offer for me PGY2?
If you're in the GP sector and if you're looking into going ahead with the GP, what you need to do the part 1, and from there onwards, getting a job in the GP sector is much easier compared to securing a job in the hospital. I'll have to confirm that. And once you get a job offer, there is a requirement for you to do a similar kind of exam to a clinical before you can start working, which is called as PESCI, and we can help you out in that direction as well. So it depends on whether you want to go ahead with the hospital or the GP sector.
I think I would say, Dr. Felix, to connect with Vinesh Nair. I think the numbers given. So this is actually a little out of scope for this session, I guess. Yes, Fahad, you can unmute and ask.
Hello, good evening. Am
Good
I
evening.
audible?
Yes, you are.
My name is Fahad and I'm a final year medical student. I have finished all my clinical exams and now I'll be doing my shadow housemanship. So my main question is, having cleared the AMC Part 1 exam, but not having an internship, does your program help in assisting candidates in securing positions in, say, the WBA accredited hospitals and entering through the WBA pathway?
Okay. The WBA pathway, there is no WBA pathway, guys. Okay. What happens is you need to get a job, number one. Okay. Once you have a job, if where you are working, the hospital that we are working, if it provides you a WBA, then you need to reapply with that hospital for the WBA post. Now, usually my recommendation is I ask all my students to do the exam. It's much more easier, faster, quicker rather than the WBA. Sometimes you probably will join, let's say that you join a hospital, you got a job placement at a hospital that has WBA, but then you learn there is a line of doctors who is waiting to complete this, and you probably, to finish the WBA itself, you might have to stay about 3 to 4 years. So that's the tricky part there. It was something that was really where people were really looking into about 5, 6 years, but now there is a wait time on WBA as well. It's not easy as where you join, oh, I want to sign up for WBA. No, that's not how it happens.
Okay, thank you,
Abo?
sir. Well, one last question.
Yeah.
If you were in like our position where we are in a situation where we are not able to get an internship, would you recommend us to take the chance and apply for a job in Australia?
So I believe you're from India, is that correct?
Yes, sir.
Okay. So I understand that you're in a very tricky situation. Now, I would say to keep your options open and to try to find number of doors as possible. Just don't stick to one door where you think this door is going to open and I'm going to go through that door. If I were you, I probably will be at least keeping about 3, 4 doors and I'll be trying all 3 doors together. That's it. And wherever the pathway opens, I'll proceed that initial step.
Okay. Thank you. Thank you, Fahad, for the question. I think we'll take just last 2 questions. And this is from Marini. I'm still doing my internship for 1 year. So during the period, will I be able to get a proper training to sit for AMC Part 1 by following this program? This
I
one,
would say,
Sujit, would you like to answer this?
Yes, definitely. I mean, like, if you are, basically what we can do is we'll be like having our classes and as well as we'll be having like a personal question and answer session. So in terms of preparing you while you are doing internships, not a problem. We can still do it.
Okay, I think Marini, maybe you should try joining the April thing so that you can meet Dr. Prakash and Sujit and get it clarified, because we had, I think, one GP who came for the training last year. Okay, this is the last question. I came across something called 10-year moratorium in Australia. Can some light be shed? Is it related to standard pathway or something different?
again, that's something that we'll probably maybe get in touch with Sujit and we'll discuss about that. It's simply, asking you if you're done part 1, you don't want to do part 2, can I work in a regional rural area for 10 years or 7 years, which will exempt you from doing part 2. That's what it is.
I see. Okay, I think again, same a participant, you can connect with the number given. Maybe Sujit, you want to put the number again, and then